I enjoy most, I think, about the interactions with people. Now, I use people in the sort of wider sense because a lot of my role now is in terms of managing staff, managing service, and doing service improvement. But all of everything I do involves people. So I still enjoy interacting with the patients, and I still do see. But I also obviously spend a lot of time, interacting with staff. And so I think that's probably one of the most enjoyable things for me. I like to make a difference and hopefully make a positive difference. Either that's to my patients, what we're doing with them, and also in terms of what we have to do with staff, and in terms of managing the services, all trying to make a positive influence on what we're doing. Well, my day-to-day job entails there's always a fair amount of emails to do. um, Dealing with some of the operational side of things, so we have to do sickness management and staff and payroll and staff rotas, and I and my colleague actually are in charge of we are in charge of rotating staff across our band 5 and band 6s across Swansea as well in terms of rotation schemes. So there's a lot of operational sort of stuff as well, but I also as part of my management role, I have a couple of sort of key things, as it were, within my portfolio from a physiotherapy point of view. So I lead the work on advanced practice, and been very much involved in part of a Wales group about developing a portfolio for advanced practice. Do a lot in terms of any education. I've got good links with Swansea University in terms of, I say, developing and looking at what staff are doing in terms of postgraduate education. I lead the audit for the physiotherapy service, and anything else really that gets given to me as well. And obviously I'm very involved with the CSP, both in terms of Welsh Board as well, but also as part of that, I also I'm also on some of the UK national groups for physiotherapy. So the main one that I'm on at the moment is the UK-wide professional practice and service delivery group of the CSP. So that's one of the committees that actually helps to deliver changes in practice across the UK. So, and I'm also involved, I have a professional network, which again, it's affiliated to CSP, which is the Leaders and Managers Network. And so I'm involved in that then as well, about developing staff and mentoring. And we're working at the moment with the Chartered Society in Physiotherapy on developing leadership training and leadership skills. I think the NHS still has a vital role to play in patients' lives. I think though the role is changing, and I think the role has to change because we haven't got the same population. We haven't got this in terms of the population is aging, so the population is getting bigger anyway. But within that, people are living much longer, but living with a number of different chronic diseases. So the NHS has got to change. It's got to adapt to be able to deal with the changing needs of healthcare. So it's still got a really vital role, but it's a role that has to change and has to adapt. And part of that role, I think, has got to be also in terms of trying to encourage patients and people to undertake some degree of self-management, to be taking more responsibility for learning how to manage some of their health conditions. And physiotherapy as a profession is very, very much involved with that anyway. I mean, I personally see a lot of patients who are suffering with long-term chronic pain. That's probably my area. So, and that's very much about trying to encourage patients to manage things and how to control their lives. But obviously physio works in lots and lots of areas, working in chronic conditions. Particularly, we've had big developments in the last year in pulmonary rehabilitation, which is obviously, in terms of this geographical area of South Wales, a lot of patients, so people do live with chronic respiratory diseases. So it's encouraging and hopefully giving patients the tools and access to be able to improve their own lives.